post-Accutane syndrome. In this video I will talk about PAS treatment, okay, because I have seen lately a few videos talking about there is no known cure for post-Accutane syndrome. Honestly, they are wrong, because there is also cure. You can improve your conditions, okay, but you really need to fix it, because I work with clients that, for example, they took Accutane as 15 years old and they still had these issues even after 15 years, okay, or even after 10 years, okay. I had one guy that he still had or still seeing issues after, I think, 25 years, okay. So you definitely need to fix it, okay. So there are three big things, okay, that Accutane can affect, okay. So first of all is B vitamins, okay. By B vitamins it will also increase the likelihood of depression, okay, of, for example, very high homocysteine, okay. So, and also it affects beta-catenin pathways, okay. So many of Accutane effects through the body can be understood in the terms of its inhibition of beta-catenin, okay. And also beta-catenin has connection to B vitamins, okay. So you really need to understand how everything is connected, okay. Even depression that are quite often seen in post-Accutane syndrome are also connected to B vitamins, okay. But it doesn't mean that, for example, you will take B vitamins and everything will be fixed, okay. It doesn't work like that. You also need cofactor, okay, and I will also talk about this. Generally, what beta-catenin does, okay, so it has effect on hair follicles, of course it has effect on skin and sebaceous gland, because I have seen one video from Derek, More Plates, More Days, that he's still experiencing this dryness effect of skin, but you can treat it, okay. So you can definitely treat it, okay. So, but if you don't treat it, you can experience a long-term dryness, fibrosis, or altered skin texture, okay. So also beta-catenin is involved in bone and healing, okay. So like too much or too little leads to imbalance, okay, osteoporosis, street fibrosis, okay. So because beta-catenin promotes osteoblast formation and tissue repair, okay. And what is extremely important, okay, so it has also effect on neurosteroids and brain, okay. So because beta-catenin regulates neurogenesis, dopamine, neural survival, neurosteroid production, even things like allopregnanolone, okay. That's like common thing with PFS, okay, because if you affect beta-catenin, okay, the more likely you can have also issues with allopregnanolone, okay. So, and inhibition of beta-catenin can lead to cognitive dulling, anhedonia. It's common for PSSD, PAS, okay, PFS, okay. So and also, like I told you at the beginning, okay, so there are three effects on B vitamins, especially B12 and folate, okay. So, and vitamin B12 is also connected with beta-catenin activity at gene expression level, okay. So yeah, one of these treatment would be supplementation with B12, okay. But like I say, you need to have adequate methylation, so not only B12 but also other things that comes into play if you want to fix, okay, if you want to fix post-Accutane syndrome, okay. So also homocysteine. The first thing I would, for example, do, and I did it last time because when I was younger I was crazy enough to take different things, okay, and I was also affected by things like this, okay. So the first thing you can do blood test for folate, you can do blood test for B12, okay, homocysteine, okay. So the first thing definitely you can do blood test for these three things. It's not that expensive, okay, do it, okay? So honestly, from my perspective, homocysteine over 8 is not good at all, okay? Also, why you need to do tests for folate and B12? Because sometimes folate can be high enough, okay? Like in my case, folate is high, but for example, in my case, B12 can be sometimes very, very low, okay? So therefore, I need supplementation, okay? So, look, many guys, they don't understand, but B vitamins are extremely crucial, especially B12, and folate deficiency can contribute to psychiatric side effects, okay? So therefore you need to fix that, okay? Also, B12 is like involved in beta-catein pathways, okay? So B12, folate are also involved in homocysteine, okay? Homocysteine is bad for your cardiovascular health, for cerebrovascular diseases, atherosclerosis, even depression, okay? So you definitely need to lower it, okay? There is more to do than just take B12, folate acid, okay? Common treatment is folic acid, okay? Stay away from folic acid. It's not a good thing, okay? If then folate, okay? So also there is another supplement really great for post-Accutane syndrome. It's lithium, but dose is extremely crucial, guys, okay? So also lithium can improve the B12 absorption, okay? So common treatment like lithium B12 can be beneficial, okay? So like I said, the problem is the dose with lithium, okay? Because lithium can also suppress androgens, okay? And also lithium can deplete other B vitamin called inositol, okay? So you always need to understand that there are connection between one supplement and the other, like vitamins and so on, okay? So if you need my help with PAS, okay, you can find my email address for coaching. Hope you found this video useful, and if you need some question, answer your question, just leave the comment under this video.